female hormone. So that affects, affects the male weight, and then he can ultimately start having more estrogen in his system. And then you also have people who are strictly, bent on alcohol. They don't do anything aside alcohol. The liver gets damaged ultimately, and one of the symptoms or manifestations of chronic liver disease, apart from testicular atrophy or shrinkage of the testes, is that they may also have growth of the breast. So you cannot have anybody already estrogenized, a man who is already estrogenized, and you expect that his fertility will be good. If the testicle that should produce quality sperm is shrunken, then what do you expect? What's the quality of the sperm you're likely to get from there? And he's likely also going to have erectile dysfunction. Then, of course, men that do a lot of smoking has also been linked to erectile dysfunction. There's a strong association between, smoking, excessive smoking, and erectile dysfunction. So a lot of people who are obese, who don't exercise well, who don't eat healthy, who eat all sorts of processed foods, amounts of calories, sugary foods, have type 2 diabetes and all that, they are at risk of erectile dysfunction, of course, which would also amount to infertility, because without quality erection, you cannot, do, the work of copulation that would increase your chances of impregnating a woman. Then for the woman also, a lot of women who have PCOS, for instance, it has been shown that because they are adding weight without trying, when they exercise and lose weight, their chances improve.
Oh, really?
Yeah, their chances improve. So one of what we recommend for them is regular exercise, weight management, being on a diet. A dietitian is going to, set up a meal plan for them that meets their nutritional requirements. So they are eating for health. They are not eating because of their cravings. They are not eating because of the hunger or the appetite, the large appetite. So they are eating exactly what they need, and they are tailored to a meal plan that suits them. So we notice that they do better once they start losing weight. Their body starts becoming more sensitive to insulin. Their sugar levels are better controlled, because those are all the things that present, with polycystic ovarian syndrome. And then for some people, endometriosis, like we mentioned, which is a very painful condition that we said comes with painful periods, pain during sex, and then you're having endometrial stroma and glands, in other sites of your body apart from where it's supposed to be in the womb. People have also linked soya consumption of soy products to it. So less soy, consumption also helps them, apart from their regular treatment that they should embark on, And it's always good to start treatment for endometriosis early too. But how would you know it's endometriosis if you don't go for health checks? So it still boils down to what we've always been advocating for. You need to go and get yourself examined. You need to go and get yourself evaluated and assessed by a clinician. That is the only way you can know what the real problems are.
I really would want you to go over the symptoms again. You mentioned, initially you mentioned that there's the one that caught my, you said when a lady is having hairs all over her body,
the PCOS,
all of a sudden. Oh, is that what you call the PCOS?
Yeah, the PCOS. Yes, the polycystic ovarian syndrome typically presents that way, and a lot of women may not know that is what they have. They just know that they have scanty periods, or periods are irregular, and they just feel it's just this hormonal imbalance and all that. But yes, it's hormonal imbalance. But what type of hormonal imbalance? There are many hormonal factors that can make your period irregular. If you have PCOS, your period may be irregular. If you have high prolactin levels, your period may be irregular. If you have thyroid dysfunction, your period can also be irregular. So all these multiple factors come into play, but you would not know which is which. You are unable to distinguish between them if you don't go for a proper analysis. That's why I always emphasize the need for you to always go for proper checks. Because you knowing what the problem is, your problem is not half solved. Your problem is like 70% solved. Because you are able to nail what the problem is. You are able to understand, okay, this is the problem. It is not guesswork. This is where the problem is. And it is because of this is happening. And science is so beautiful. Everything is evidence-based. Everything is logical, very rational. There is explanation for it. If this is not right, then this is happening. So how do we correct what is not right? This is imbalance, or this is too much, or this is too little. We know, are you having a deficiency of something, or are you having an excess of something? and we are going to be able to institute the right management you need for you. But when you don't know, you are not sure, it's guesswork, because your aunt or your sister had a particular kind of condition, and you assume that you're having the same condition. That is absolutely a wrong assumption, because you would be wasting valuable time and money chasing the wrong things. And if you invest in all the wrong products that are flying all around, promising you heaven and earth in one bottle, in a magic bottle containing a content that would flush out your womb, flush out whatever, open up your blocked tubes, they promise you all that. You keep investing in something you have not verified. You keep investing in something you don't know what the short-term, medium-term, or long-term complications or effects would be on you. At the end of the day, you find out that you have yourself to blame. So please, let us make wise choices and listen to quality professional advice and do the needful.
That's why I said you took time to mention the causes. And that's why I also wanted you to mention the symptoms, what you should look out for, as you progress, as you begin. I mean, you should be able to examine yourself, before you even approach the hospital for any test. So that's what I'm asking. What are the basic symptoms to find out that, hey, infertility is creeping in, or maybe I have one infection or the other? Let's look at it both.
Okay,
both sides.
Yeah.
Both
so
sides.
if we're starting from infections, because we're talking of the female gender now.
Female
So if you're thinking of infection, so when you start having pelvic pain, chronic pelvic pain, that's your lower abdominal pain, and then it's recurrent, it's always there. You're having an abnormal vaginal discharge. We want to know when the discharge started. We want to know what's the color of the discharge. We want to know whether it's associated with itching. We want to know if your period is regular. We want to know if the vaginal discharge has a bad smell. Okay. All those tell us something. If it has a fishy smell, it tells us something indicative of bacterial vaginosis, for instance. If it is whitish, cottage cheese-like and itchy, then you may be dealing with vaginal candidiasis. So there are so many types of discharge that you can have, and the presentation gives the doctor the idea of what you do have, though you're still going to be properly investigated. Then apart from the pelvic pain, you may also be experiencing pain during intercourse. If you're experiencing pain during intercourse, it's something you should also investigate. You may be dealing with endometriosis, you may be dealing with cervicitis, which can also be very important factors. So all these are very, very crucial. If you're having a greenish yellow vaginal discharge with itching, you can have what we call a trichomonas infection also. So all these are very, very key. Then for people that have gonorrhea and chlamydia, which are sexually transmitted infection too, you also have vaginal discharge. You may have a burning sensation when you're peeing. All those are things you should never ignore. So once you have all these things and they're coming along with other features like you're gaining weight without trying, you also notice that your period skips, your period is not regular. Maybe you see your period this month, next month you may not see it for another 2 months, then it comes again, and it's not like you're perimenopausal, you are not over 40 yet, because as from the age of 40 in the perimenopausal period, some people start having symptoms of early menopause coming up, so they may start seeing those irregularities in their periods, but that you're still far from that age. And then you're beginning to have irregularities in your period or your scanty period, or you are not seeing signs that you are ovulating, because during ovulation you should at least have a clear discharge, like the egg white, a sticky clear discharge, but you're not even experiencing any of that. All those things are worth checking for. Then if you're having severe heavy menstrual flow, for instance, amongst people or ladies of African descent, fibroids is a very, very common condition in their reproductive age group. So you find out that a lot of them are bleeding heavily, they may be having pains, they may be having pressure symptoms, depending on the size and location of the fibroid. If it's impinging on the bladder, you find out that they're having urinary frequency, they have the urge to pee all the time. For some, they may have varicose veins because it's obstructing venous backflow to the heart. And some of them may also have pain when you have the fibroid getting complicated in a way we call red degeneration. That's a process that causes degeneration of those fibers, and it can really be a painful experience. Once you're having any of these things I've mentioned, just please make sure you get yourself evaluated. If you notice also, like we mentioned, you're having more acne outbreak in relation to all these things I'm mentioning, please go and see your doctor because you may be having some hormonal imbalance. If you check your nipple and you find out that you are having nipple discharge, a milky white nipple discharge, you may have a condition called galactorrhea. Galactorrhea is from high prolactin levels, and it may be that your prolactin levels are extremely high, either from some medications you're taking, or maybe you may even have what we call a prolactinoma. Okay. It's around the pituitary gland. It's like a tumor growing there, and then it may impinge on your optic nerve, giving you blurry vision. So if you're having blurry vision with a milky nipple discharge, please run to your doctor because he may need to send you for some imaging of the brain to notice if you have prolactinoma. And if you do, the right treatments will be instituted. And if you have high prolactin levels, please, it is very important. I've seen many women, a lot of women actually have high prolactin in Nigeria. I have seen that, especially women who have had one child and they're trying to find to get other children, trying to achieve pregnancy again. They will tell you prolactin was never high, when they were having their first child or when they were preparing to have their first child. But now prolactin is a problem, and if they place you on medications to lower prolactin levels, please stay strictly adhered to that medication and to the regimen because you are going to be on it for a while. And for women that have thyroid problems too, either you have hyperthyroidism or hypothyroidism, you may also find out that you are having menstrual disturbances or menstrual irregularity, which ultimately can affect your chances of conception. So you can say that it's more complicated for women because you have more causative factors that can cause all this. And you should go for HSG. HSG, very important. That's the particular investigation that helps us to know whether the tubes are open or not. Because if you have blocked tubes, there is no way natural conception is going to happen, especially if the tubes are blocked on both sides. So it's very key. A lot of women may just be carrying blocked tubes around. They don't know because they've had infections in the past. They didn't treat properly. Now the tubes are blocked. They have no idea. Though they may be seeing their period, everything seems normal, but the tubes are blocked. So how are you going to achieve pregnancy? So it's very good for you to go for these investigations, exhaust all these investigations. Yes, I know they cost money. Yes, I know they come at a cost, but it is to your own benefit at the end of the day.
Okay. Now, let me start reading out questions. Everyone, let me do questions now. Do I still have my questions a whole lot of it? But let me just start mixing up one after the other. Okay. In case you want to ask a question, you can send a message. We're streaming right now. You can share the broadcast also, and then you can also just drop a message, get to the comment section and then drop a message for me. Okay. If you want to join me on YouTube right now, just go to YouTube and type VOP 90.3 FM and then hit the live button and you're just there. Okay. Thank you very much. Now this person is asking, he said, Doctor, after 3 years of waiting, God finally answered me this year. I don't want any delay again. No, please, sir, what can I do? I refuse the family planning that I was given to by, where I delivered, where she gave birth. Family planning care. Hey, come and do this thing. Let me do this thing.
Congratulations. We thank God. We thank God for you.
Okay, hold on. Before you answer the question, sorry, 081 717 56338 on WhatsApp. That's our WhatsApp number. VOP WhatsApp number. 081 717 56338. Or just go to YouTube and type VOP 90.3 FM and you're just there. You can also send the message there. Okay. So Doc, talk to us.
Yeah, so congratulations to the new mother, and then we hope that they will come in quick successions. Maybe the next will be twins or triplets, hopefully.
Okay.
Yeah. So, I think for her to have achieved pregnancy naturally, then that means that it can happen again. It can happen again. But I would advise, I don't know what her age is, but if you're advanced, so to say, that means maybe you're above 35. I would advise that you get your pregnancies, very quickly.
The one the Roman called chap.
So it's very, very necessary. But if you still have age on your side, well, I would still advise that since you still have a child and you achieved it naturally, don't let it be too long before you get the rest. It's very important. Just make sure that you are healthy, you eat well, and then you have all the right supplementation. Folic acid is very essential, when you're looking forward to conceive, and a healthy diet, very, very essential. And making sure that you don't let anxiety get into the picture, because one thing is anxiety also, to a large extent, affects a lot of women. I've heard a lot of women say, oh, each time they don't see their period, there's a little delay in their period. They are so excited, they quickly go and get it checked to see if pregnancy can be confirmed, and then they are disappointed when they see their period. All that, shows that anxiety is in the picture. Then some of them will tell you that when they even stop bothering, when they even stopped checking, that's when it happened, when they least expected. So sometimes it's like that. So I think you should be relaxed. I think you should be reassured that God that has given you this one will give you other ones. So don't let anxiety get into the picture. But if you are above 35, I advise that you get it over and done with quickly.
Okay, in case you are trying to send a message, note, I don't play voice messages, no, or voice notes, no. Type for me, send it, okay? I don't play voice messages. Thank you. Let me read this one. It said, this doctor is cerebral. So detailed and relatable with his analysis. Some doctors go talk like this. Plenty medical jargons go past the actual explanation. But this doctor is so simple and relatable with his analysis. Well done, Jude, and our Thursday Dr. Tonic.
Thank you so much. Sorry, who is that, please?
You know, can add name.
Oh, thank you so much.
Okay,
thank you.
Let's look at this again. Please, my case is that I don't have my regular period, but I don't have my period regular, but it doesn't flow as in the sense the first day it will come, second day very scanty, third day stops for almost 15 years now. I've treated infection several times, and yet my period flow still remains same. What's the chances of one getting pregnant when diagnosis with adenomyosis?
Adenomyosis.
So in spell I'm here. I'm in my 40s and no child yet. Someone sending this message from Ebutemeta.
Adenomyosis. Yeah, adenomyosis is a condition where you have the glands, present in the muscles of the womb, So basically, it can be a painful situation too, and it can be contributory to what we're talking about. So I don't know what investigations she has done so far, and I hope that diagnosis is even correct in the first instance, because many times, in Nigeria, we deal with a lot of misdiagnosis. So misdiagnosis would always veer off your management or your correct treatment, at a tangent. You just be thrown off course, because if you don't know what the real problem is, you'll just be treating so many things. Because the truth is, in medicine, there are many conditions that mimic each other in terms of symptoms. Their symptoms are overlapping. They have similar symptoms, but you should be detailed enough to be able to distinguish what is exactly this particular patient's case. Because if you are treating somebody for another condition, whereas the person has a different condition, not only are you wasting money, not only are you wasting time, and the patient is also taking a treatment they do not require. So it's very important that if you have gotten this diagnosis, I would advise you, because you live in Nigeria, I would advise you to have a second opinion of your case. Have a second opinion, go for another set of investigation, let a different specialist review you, and listen to another expert opinion on your case. And if you're still having menstrual irregularities, all the previous investigations I talked about, the hormonal investigations and all that, would also come to play. But mind you, if you're in your 40s, you can be perimenopausal already, so your period may not be expected to be as regular as it used to be. So that's another factor. So we would run some hormonal tests for you to know if menopause is already setting in or not. And then we also need to have another expert evaluation of your case to know whether you are actually dealing with adenomyosis or it's actually a different case entirely.
Okay, this person is asking this question. Let me get to YouTube. Questions on YouTube now. Good morning to you. This person is saying, please, I have a question. I have been having a serious waist pain on my right waist since a week now. Please, what could be the cause? And then said the second question is, my period flow only 2 days. The third day is just a drop. What should I do? What could be the cause?
Okay, so it's the same person with the two.
No.
Okay, one person with the back pain.
Yeah, okay. Oh, yeah, the same person.
Oh, okay, the same
Exactly.
person. Okay, so when you're having back pain, it could be something. It could range from something very minor to something a bit serious. It could be just something postural. It could be how you sit. It could be how you bend down to lift things. It could depend on the kind of job or work you do. It could depend on how many hours you sit for. If you're always sedentary, or the kind of chairs that you sit on, all those postural things can give you a bit of muscular aches and pains and all that. But another thing is, if you're having flank pain on your side, because you said on one particular side, I hope you don't also have urinary symptoms like frequent urination, pain on urination, a bit of nausea, because you could also have what we call pyelonephritis, which is an infection of the kidney. It's a UTI that ascends, a urinary tract infection that ascends all the way to the kidneys, and it can give you what we call renal angle tenderness or loin tenderness. So I think you should go and get yourself checked, because I don't want to assume it's only postural, because women have UTIs. It's commoner in women than in men. Yeah, it's commoner in women than in men, because women have shorter urethra, so you can have infection ascend easily. So it's very crucial for you to improve on your water intake. First and foremost, that's one of the most readily available treatment for a UTI. Increase on your water intake. Once you feel the need to pee, you feel that urge, don't hold on to your urine, go and empty your bladder. All those are very important. Respond to the call of nature at once, as they say. Then secondly, you try to go for a scan. You can do an abdominopelvic scan just to check your kidneys to be sure you don't have pyelonephritis. Take a look at your bladder, also your urinary tract. Do a urine test. And if all that comes out clean, then you may probably just have a muscular strain. But if the pain persists, then you may need to go for maybe an x-ray to check your lumbar area, just to see if something is happening there. But it's going to be around that. And about your menses that you say is scanty and
2
all
days
that.
and the third day.
And if that is unusual for you, it wasn't like that before, I don't know what your age is, but all the same, you still need to be evaluated. You need to do some hormonal checks. You need to do some scans for us to be able to nail exactly what is wrong with you, because multiple factors may be responsible for this presentation.
Okay, let me read this question, everyone. All right, let me read this question. He says, okay, good morning, please. My name is Emmanuel. When my wife was pregnant, I was told I had hepatitis B. And it has, hey, calm down now. And it has not been treated. I have not been able to treat it since, but I don't have any symptoms yet. How can I go about? I'm trying to understand. What are you saying?
Something about hepatitis B.
Had hepatitis B. I have not treated it since, but
Yeah.
I don't
Okay, I
have
think I
any
understand what you're
symptoms
saying.
yet.
Yeah. Okay, yeah, that's a very good topic to also talk about. Hepatitis B is a viral infection, that typically is transmitted through.
We're going to be talking about hepatitis B very soon.
Yeah, it's important
Very soon. Maybe
because
next
it's something. Yes, because it's something that is also quite very well amongst us, and not everybody shows symptoms. So hepatitis B is a viral infection that is transmitted through sexual fluid, through blood and blood products, through sharing of sharps. An infected mother can transmit it to her unborn baby, and basically it's
Unborn baby.
Yeah, it can be transmitted, across the placenta during childbirth and all that. So it's very crucial that we are well educated and we create enough awareness about hepatitis B. And hepatitis B, once you are positive to hepatitis B, it's very necessary that everybody around you should be vaccinated. Because a lot of people in Nigeria, apart from the health workers that work in the hospital that deal with, a lot of patients, and maybe you come in contact with blood and blood products, I know a lot of health workers are actually doing well to vaccinate themselves against it. But regular people, I don't know how much of awareness is going out there about hepatitis B. Hepatitis B vaccination is important, especially when you have a spouse that is positive. You have to get yourself vaccinated. And for the person who has the infection himself, he should note that hepatitis B, as the name depicts, hepatitis means inflammation of the liver. So that means that the virus, it has a predilection for the liver. It goes straight to the liver, causes inflammation in the liver, and ultimately over time can progress to what we call liver cirrhosis, and over time to liver cancer. So it's very important that you don't take it lightly. So once you are positive for hepatitis B, the next thing for you to do is to go and do a viral load check and to go for the hepatitis B profile. The hepatitis B profile will let us know if you have the dormant type or the actively replicating type. Because you have the dormant type that the viral load is not so much and it is not actively replicating at a fast rate. So it stays relatively minute in your blood in quantity, in terms of volume in your blood. And then your rate of infectivity is low because you don't have so much of the virus. So you are not, the ability for you to transmit it to somebody else is minimal. But you also have some people who have the actively replicating type that progressively advances to the advanced case of cirrhosis, liver cancer, and all that. And then the rate of infection is high. So how do you now know who has the dormant type and the actively replicating type? If you don't go for the hepatitis B profile, you would not have an idea. So you should go for the hepatitis B profile. It's available in most of the teaching hospitals, in most of the government facilities, and even some private diagnostic centers. You ask for the hepatitis B profile panel. You go for that, and you go for your viral load. The viral load gives you an estimate of the number of viruses you have per mil of your blood, and that tells you, you know where you actually stand, so that you are able to start treatment early, because there are antiviral medications and there are some other medications we give you to protect your liver. And as a final warning to him, if you already have hepatitis B, that means you have something that's, so to say, an enemy of your liver somewhere. So you are not a candidate for chronic alcohol consumption. You are not
abstain completely.
Exactly, if you can. You are not a candidate for abusing drugs, self-medication, because there are some drugs that are too heavy on the liver. You are not a candidate for abusing analgesics. You are not a candidate for agbo or herbal mixtures or herbal concoctions that you don't know what the constituents are. You need to be intentional about everything you consume, and you need to go for regular health checks. You go for your liver function test, and then you go for your liver scan, so that we look at how your liver is structurally, and making sure that you are not having some changes that are showing that it is advancing. So it's very key. So first thing, hepatitis B profile, hepatitis B viral load, and you go and see a gastroenterologist. That is the specialist to see for a good follow-up.
Okay, thank you. Please, I want to ask, what's denigrating fibroids?
What's
denigrating fibroids is what this person is asking.
Fibroids. We talked about fibroids. Was it last week?
No, 2 weeks ago.
Okay, or 2 weeks ago. So fibroids generally, we can just have a recap of that. Smooth muscle, connective tissue, and of course it's only found in women in their reproductive age group, common in women of African descent. So depending on the size, depending on the location, then that determines, the symptoms you'll be experiencing. But for most women, they find out that they have heavy periods, prolonged periods. Your periods may be lasting for 7 days or more. They are heavy. You're changing your sanitary pads about 3 to 4 times or more a day. You're having passing blood clots. You're having pain, or you're having your legs swelling, varicose veins, and then, or in some people, you're peeing more than usual. All those are signs that you may be having fibroid or something growing in there. And we also noted that it increases more during pregnancy. So it can coexist with pregnancy. It can coexist with pregnancy and occupying more space, or competing for space with the baby, leading to malpresentation, leading to the mode of delivery of the child probably going to be a cesarean section. And there's also a high likelihood of you bleeding heavily after childbirth, because of the presence of the fibroids. It's not allowing for proper uterine contractility after the child is born or after the placenta is removed. So basically, if you have fibroids, the best thing to do is You go to see your gynecologist. We know the size of the fibroids, whether it's solitary, that is if it's one, or there are multiple, and then where they are. And if your best options are going to be certain hormonal agents or certain injections that will give to shrink the fibroid if it's not too big. But if it's too big, you may be a candidate for myomectomy, a removal of the fibroid surgically.
We have too many questions here. Too many questions. And then I want to, before I read the next question, I want to use the opportunity to say, if you are into health, I mean, if you own a pharmacy or if you own a hospital or you are just into health, like generally, we can do business. Okay? Yeah, we can do business. Any part of the country you are, we can do business. Yeah. All you need to do is just to, let me drop a number here now, and then, okay, let me do this first. 070 121 46454. All right, just send a WhatsApp message to that number if you want us to do business, or if you own a hospital, if you own a pharmacy, or you're into health. Just drop a message, a WhatsApp message, there. The number again is 070 121 46454. Again, 070 121 46454. And we can do business. Just drop is a WhatsApp number, okay? Just drop a WhatsApp number. Drop a message there on the WhatsApp number, okay? Thank you very much. And then again, doctor was saying something about going out for outreaches and all of that. Maybe you talk about that.
Oh, okay, yeah. And we're very big on community outreaches because we're focused on preventive care and passing out relevant health information to the populace, because we know that prevention is better than cure, like so we're very keen on passing the right health education on health promotion strategies. How can you better your health? How can you stay well informed? How can you improve on your health? How can you stay healthy? All these are very crucial. And then we're also into health trainings and health seminars, conferences, health talks for churches, for estates, for communities, for schools, because we're beginning to see a lot of things happening to our youngsters, our adolescents and all that. We need to start talking to them about reproductive health. We need to start talking to them about drug abuse, substance abuse. We need to start telling them about mental health. And then we need to also get across to people who are dealing with one addiction or the other, and they're looking for how to break away from those addictions, either smoking, alcoholism. They're looking to be in a rehab. They need counseling services. They need a psychology to review, a psychologist to review them. One health issue or the other. So it's an all-encompassing thing. So if you're a corporate organization and you would want wellness trainings for your staff, you want basic first aid training, you want emergency response trainings, we are very big on that. And then we can have some very good collaborations together.
All right. And so that's why we've been able to provide an avenue where you could reach out to several doctors on just one platform, and that's Doctor's Mike on Facebook, Doctor's Mike on Instagram. Doctor's Mike, doctor, you know how to spell doctor, right? DOCTOR''S. Doctor's Mike. Mike is MIC. Okay, so you can go there and drop your message, just any health issue or any concern as regards health, just drop your message there. There are plenty of doctors there, ranging from, please, doctor, help me. What kind of doctors?
We have all the doctors. We have the general practitioners. We have the surgeons. We have the gynecologists. We have the pediatricians. As the case may be, you can just drop your comments, your questions. We'll be glad to help you out. We'll be glad to give you the right guidance you need, and find solutions to your concerns.
Of course. All right. But for business sake, you want us, okay, like we're also open. This show is open for sponsorship and advert placement. Okay, we're open. Yeah, whatever you do here, you repeat big time, I tell you. Okay, that's why I'm saying, if you own a hospital or a pharmacy or just into health generally, let's talk. And I gave you the number, right? 070 121 46454. Okay, yeah, that's the number. Okay, now back to your questions. Okay, for all of those persons asking for a number, I think you have it already, or how to get to reach out to the doctor, you have that already. A couple of persons asking, hey, can I get the doctor's number? Can I reach out to the doctor? You have it already. Doctors might just get there and you get to reach so many other doctors there waiting, okay? Now, good morning. It can be Judy and the doctor in the house. Sorry, I missed the name. Yeah, it's fine. Emmanuel from Ojo is saying, I've heard people say that men confined to wheelchair are most likely to be infertile. Is that true?
Well, the truth is, when you are confined to a wheelchair, that means you have mobility issues. You probably have a spinal cord injury or some nervous issue. If you listen to the program last week, we said for a man to achieve quality erection, it's a function of two factors. So first is quality circulation to the genitals, and then the second is nervous coordination. So the nervous coordination may be affected when you have spinal cord injury, and not only sexual function, you may also have problems with urination and defecation control, because all these are under spinal control. You have a lot of nerve networks that control how your bladder works, and the control of the bladder sphincter, the ability for you to hold on to urine so that you don't just pee on yourself without knowing, or the ability to have bowel control also is also dependent on the spinal cord function. So it's very possible for that to happen. Truly, it's very possible for that to happen. So most people who may be on the wheelchair need to be properly evaluated by a neurologist to actually know if it's responsible for whatever sexual function dysfunction they're having.
Thank you. Someone is asking a very vital question. I want you to answer this. Doc, I had my menstruation at on the 6th of the month, and I'm seeing another on the 13th again. This is my first time
of seeing this.
Am I sick? I'm in my late 30s. My mens is always 5 days. What's wrong?
Well, sometimes we have what is called metrorrhagia, where you have bleeding in between periods. You have your period within a certain time, and then the next period is within a certain time. But in between, you can be seeing some bleeding and all that. So all those should be investigated. But if this is happening to you for the first time, I would say just do a watchful wait. If it happens in the second cycle, then you may raise an alarm and then investigate accordingly.
Okay, thank you. Please, Doc, must anyone that has infection or treating infection get all her undies burnt? Like the way they say you have to burn them, or you wash with salt, or you sun dry them properly and all of that while treating the infection. After carrying out some medical tests or lab tests and all of that, you have infection and you're treating it. Must you burn all of these things and get fresh ones?
Well, the most important thing is that once you have an infection, the first step is, first and foremost, diagnose what kind of infection it is. Secondly, complete your treatment. Then thirdly, do what we call contact treatment. It's very important. Treat your spouse or your partner so that you don't keep reinfecting each other. A lot of people miss out on that. That's also very key. But for people that have something like vaginal candidiasis, we also tell women, please make sure that you sun dry your underwears and then you iron them. And then secondly, I think it's also important for us to note here that women are prone to infections when they use all this intimate wash, feminine wash. They do what we call vaginal douching. A lot of women, they invest in certain products that they use to cleanse their private parts, and once they cleanse that thing, they don't realize that they wash off useful bacterial flora that is there, because that area is supposed to be acidic in nature. The pH of that place should be in the acidic range, and by the time you have washed out the normal flora using either an antiseptic or some kind of cleanser, you're going to disrupt the normal balance there, and that would encourage the overgrowth of the wrong kinds of organisms. And that's why a lot of women, until they stop using those substances or all those cleansers, they are going to keep having recurrent infections. Then aside that, if you are having frequent infection, you should also screen your sugar, check your blood sugar, screen for your blood sugar, because if you are having high blood sugar or you're diabetic, you may be having recurrent vaginal candidiasis. And then we also need to know if you're on steroid medication or you are immunosuppressed in any form. All those can also predispose you to having all those infections. Then for people who self-medicate and you're taking antibiotics for prolonged periods, it's not the doctor that placed you on it. You bought Ciprotab or Augmentin by yourself and you're using it indiscriminately, then that means anyhow, as you will. You just wake up one morning and say, I think I need Augmentin. I think I need Ciprotab. And you go to the nearest chemist and then you buy and you keep using. You're going to wipe out the good bacteria in your body. Not every bacteria is actually pathogenic, meaning causing disease causing. Not all of them are disease causing. Some of them are beneficial to you in your digestive tract, in your reproductive tract. They are there to protect you, but you wipe them off because you're taking your antibiotics indiscriminately. So we need to desist from this. Yeah.
Okay. Someone that have aspema.
Azoospermia.
Is it azo?
It's azoospermia.
Okay, aspema ain't right here. What is the remedy for it to get women pregnant?
That's a big question. Azoospermia means that you don't have any viable sperm cells in the ejaculate. So that means that first and foremost, you need to have something for us to say we want to boost what you have. So when you don't even have anything,
Nothing to boost.
exactly, when you don't have nothing, so where do we start from?
Wow.
So first and foremost, you need to do a thorough investigation. You go for your hormonal checks. You go for what we call a testicular scan, because that helps us to know, are your testicles even producing sperms at all in the first instance, or if there are any findings in the testicle that would let us know if anything is deterring your sperm production. So basically, there won't be any harm in you trying some supplements that have been proven to help boost sperm count and all that, but I can't be saying them here on air. So you have to probably see a urologist. The urologist will send you for what we call a seminal fluid analysis and semen culture to find out if you have any infection, to find out if you are truly azoospermic, that there are no viable sperm cells there at all. But if truly you are now confirmed to be azoospermic, then you will be seeing a fertility expert who would find another way of extracting sperm from your testicle without you ejaculating, and then do an in vitro fertilization, for your wife.
Okay. All right, I think that's great. That's great. Let me see some other messages now quickly. Okay, I always have a burning sensation on my body whenever I wake up in the morning. Please, what could that be?
Yeah, well, burning sensation, it could be something from your nerves. You should go and get your sugar screened, and then you should make sure, especially if you have a positive family history of diabetes, you should get that checked, or maybe you're overweight. You should start working on that. And then you could also be on some nerve supplements, that can help you with those, unusual sensations, or otherwise you go to see a neurologist.
Okay. And someone is asking, what's his name? He's from Ikpaja anyway. He said, please, is it true that milk taking can increase, prostate cancer, in men, and also eating a lot of pepper?
No, that's not correct. Prostate cancer increases with age, and then there's a strong genetic factor to it. And basically, for people who are worried about what they eat, well, red meat consumption, excessive red meat consumption, has been a factor. And of course, smoking and alcohol or obesity, all those are mostly implicated in development of most cancers. But for milk and pepper, that's not a validated or documented fact, for prostate cancer. But as you grow older, the risk of it increases. So we tell every man after the age of 40 to go for their PSAs at least once a year. And then depending on what the level of the PSA is and your ultrasound or imaging findings, your urologist may determine to do a biopsy for you if it's indicated. And once a biopsy is done, if it's confirmed that it's prostate cancer, then they institute the right treatment for you, either hormonal treatment or radiotherapy or something surgical, depending on what the urologist deems fit in your case.
Can hepatitis reoccur or come back to a person who have suffered it before?
Hepatitis, typically, it's a viral infection, like we said, and then when people have it, sometimes if it clears out, then they build some kind of immunity against it. They are sometimes immune against it happening again, but it's very possible that once you have hepatitis, just make sure that before it starts affecting your liver, you go and do your thorough checks. You know, we mentioned the profile panel, the liver function test, and all that. So once you've had it before, just always be on your toes in making sure that you go for regular checks, so that even if your body clears it out in some cases, you may actually be immune, you know, at that point to it. Somebody sent a funny message.
He said, Jude. He said, this doctor now original.
Thank you.
Oh God.
And thank God.
Dr. Charles Adiogo. All right. Okay, it's
thank
okay.
you, thank you,
okay.
and thank God.
Just few minutes to run. Like, quickly. How can I take a hepatitis vaccine quickly?
Okay, hepatitis vaccines are available in most hospitals, private and government hospitals, and especially the health centers. I'm sure they have hepatitis B vaccine. You know, hepatitis C vaccine does not exist yet, but the hepatitis B vaccine, we have it, and then they are in 3 doses. You take one now, then you take one after 1 month, then the next one after 6 months. So they are in 3 doses for you to have a complete protection, you know, against hepatitis B. So it's available, even some pharmacies. It's available in some pharmacies. I may not be able to mention, but
no, that's why they need to. That's why I told them, if you see now,
but it's not difficult at all. It's not something you would have.
That's
why
I said, if you run a hospital or you have
this is an
pharmacy,
opportunity. Yeah,
just send a message, a WhatsApp message to 070-121-46454. 070-121-46454. All right. And let's talk. Let's talk. We'll not just mention your name like that. No, we need to talk first. All right. Just send a message there. Thank you. Like I said, Doctor's Mike. Okay. Doctor's Mike. Don't forget on Instagram. Doctor's Mike. A lot of doctors are waiting there for you. And then let me look at this other message. Yeah, the doctor was so highly encouraged, has encouraged the helpless people with the last words of encouragement to depend on God. Okay, it's okay. It's okay. Fine. Good morning, please. I used to have a shock on my hand and at times on my body. Please, what can cause this, or what should I do?
Shock. When you say a shock, it can be what we call numbness. It can be what we call paresthesias. It could be all these abnormal sensations that you have, usually of nerve origin. But there are a lot of questions to ask you. For instance, if you take a lot of alcohol, if you are a chronic alcohol consumer, then your vitamin B vitamins, may be low. Because vitamins, are depleted. The vitamin stores are depleted for people that are chronic alcoholics. So you may be deficient in some important B vitamins that are very important for nerve function. Your sugar levels may be elevated, like we said. And then you may also have other neurological issues coming up. So you need to investigate appropriately, stay active, exercise your limbs as much as you can. Make sure that circulation is ongoing. Because if you also have a circulatory issue, you may also have those kind of feelings. Then you should also go for some simple blood test that checks your calcium and magnesium levels. All those may also be implicated.
I'll touch on this message, just the last one, and then maybe just recap on what's it called now, the outreaches, right? And then we go. Just quickly answer this one because of our time. Please, does washing of the vagina with ordinary water has any effect or disadvantage?
No, if it's ordinary water, it's fine. But if you're using antibacterial soap or antibacterial, Dalchin solutions or cleansers or intimate washes, then it becomes a problem because you're going to disrupt the normal balance of the vagina and disrupt the normal pH. So that's that. So with water, yes, you're good to go. Then, for the outreaches, yes, we are also very active with community outreaches. We go into certain underserved communities, and with our team of doctors and nurses and lab scientists. We are available for such services. So for organizations that want to do their CSR via that route, we are very available to help you plan, such outreaches, because such outreaches require an initial baseline survey, which we have to go into the communities, meet with the stakeholders, find out the demography of the people there, how many adults, how many children, what are their prevalent problems, what are the issues they have, what are the factors that are really, really affecting them there, so that we go back to our table when we are planning and we're able to actually design a very, very impactful program that while we go into the community, our intervention is going to be worthwhile and is going to really impact lives positively. And then maybe after a month or two after our community outreach, we'll go for a re-evaluation so that we can do an impact survey, so that we're able to know what the impact of what we've done in that community has been to them. So we're available for that. We meet with churches who organize such, corporate organizations who want to do that as their CSR. We are very much available to help you do that.
All right. This one is a yes or a no, because I know, say if you want to explain, you go long, you go tell. Can weight prevent a woman from conceiving?
I won't say weight just on itself.
I know, so you go.
But weight, that weight thing comes with other things. If you're hypothyroid, for instance, you can be overweight. You don't know why you're adding weight, but the thyroid dysfunction is causing menstrual irregularity, which is affecting your fertility. PCOS can make you add weight, and then you would think it's the weight that is not making you have your baby, but it is actually the PCOS or the thyroid problem. So we need to know what the issue is. There are a lot of overweight women that have their babies normally, so it's not really weight that is the problem. It is actually things that are associated with infertility but present as being overweight. Being overweight is part of the symptoms of such conditions.
Thank you so much, Soko.
Thank you.
07012146454. Let's do business, okay? If you have a health, if you're a health practitioner, you have a hospital, you have a pharmacy, let's talk. Just send a WhatsApp message to that number, 07012146454. It's time to go. My name is Jude, and on social media, I am Ikami Jude. It's spelled IKAMIJUDEH. Again, IKAMIJUDE. It's just one word. On Facebook, Instagram, Twitter, TikTok, everywhere. It's just the same name, Ikami Jude. I love you all so much. Don't forget, it's Doctor's Mike also on Facebook and Instagram alone. Doctors MIC, Mike. Thank you so much. I'm out of here. Good morning to you. It's still morning, 11:58. It is well.